talk about tracheal shave. It is a small procedure that is done under general anesthetic on an outpatient basis. The surgery itself takes about 45 minutes to an hour to finish. The goal of it is to reduce what is referred to as the Adam's apple, which is that bump on the neck. And what that bump is actually the thyroid cartilage. It has a particular form and it has a peak to it, and that's what sticks out. So for me as a surgeon, I have to know in general where the vocal cords insert on the back side or the inside of that thyroid cartilage so that I can avoid injuring them. The incision I make on the skin of the neck is usually about 1/2 inch to 3/4 of an inch, depending on the person's neck anatomy. Sometimes it's an inch, and that's okay, it's still pretty small. I try to make it at the cervical mental angle, which basically means the junction between the under chin and the person's neck. And so this is the angle right here, the natural crease that people have. And so I try to make it at least at that height or even a little bit underneath the under chin so that it's very well hidden when someone's talking to you at like eye level. You can't see the scar at all. Now the easy thing to do is basically to cut right where the thyroid cartilage is. Mine is right here. And that's less ideal because the scar would always be visible and it would look like you had like thyroid surgery for cancer or for other things. And so it's best to avoid that scar, but there is a limit on how far up I can make that incision because I also don't want to struggle trying to do the surgery through a tiny incision and through a very long tunnel. There's a limit to how much I can reduce someone's thyroid cartilage because of where the vocal cords are. And so for folks who have very, very large ones, my goal is to at least get them to have a little bit of a bump rather than a sharp peak so that they still pass as a female neck. As I'm doing the surgery, I redrape the skin, meaning I put everything kind of back into its position, extend the person's neck, meaning making them look up while they're on the table. They're asleep, of course, but looking from the side to make sure that the profile is really as flat as I can make it. So afterwards, I put the neck muscles back together and I close the skin. There are no drains for this. And people wake up and they should have a fairly normal speaking voice. They do have a tube going through their throat. So if the surgery is done alongside with other facial procedures or top surgery or bottom surgery, then having that tube irritating the vocal cords that whole time. They might have some hoarseness for about a day or two, but usually the voice returns to normal fairly quickly. Recovering doesn't involve any difficulties in eating or swallowing. That should all be very normal. Once it heals, the incision is barely visible. It usually just looks like a natural crease line. Like any surgical procedure that I talk about, I also try to talk about the bad things that could happen, right? There's always surgical risk to any procedure, no matter how big or small. And so specific to tracheal shave, as I had mentioned in one of my previous videos about my vocal cord surgery that I'm having soon, I didn't even know that I may or may not have had damage from my own tracheal shave that was done a long time ago. It didn't affect my voice. If anything, my voice got better, but only because I was sort of training my voice and I was getting on hormones and transitioning. And so I didn't even know up until a few months ago when I went to see my ENT doctor for vocal cord surgery that I found out that, again, I may or may not have suffered a little bit of vocal cord dysfunction. For the most part, patients heal quite well. Their scar heals almost invisible and their lateral neck profile is very flat, so their confidence is up. Now, there are patients who have told me that they can't quite sing to a certain high note, And so that's been bothersome. For patients like that, they can go to speech therapy to try to help them retrain to gain that high of frequency when they sing. That's only been a handful of patients. I have had some patients that I did that felt like their regular speaking voice is okay, but they're not able to hit certain notes. And so now I just tell everybody there's always a risk of altering someone's voice. And if someone's like a professional singer, which I haven't had anyone be a professional singer, I would be very, very careful about at least informing them of the possibility of them not being able to hit certain notes. Now, a few patients have said that the quality of their voice hasn't been as good since the surgery, but not to the point where it's absolutely detrimental. But they went and got evaluated for vocal cord surgery, and they kind of have the same thing I do, meaning that my vocal cords aren't quite normal. They don't close all the way. One side's a little bit weaker. And that seems to tie in with having had a tracheal shave. And so, at least for me, I feel like it probably was due to the tracheal shave, and I wouldn't have done anything differently. And I still think that my surgeon did a great job of reducing my Adam's apple. I've been happy all these years about it, and now that I've discovered that maybe there's something a little bit off about them, it's just more of a surprise than, oh, I'm so upset, I'm so mad that this happened. No, it's not like that. And it wasn't a factor in me getting vocal cord surgery because I didn't even know that I had what I have in terms of my vocal cord abnormalities. And so, and I know that the vocal cord surgery itself won't fix the problem, but I think it'll still affect my voice positively. So anyway, so that is a trach shave, and always speak to your surgeon about their experience in performing it, how they approach it in terms of incisions, how they do their surgeries, and whether they have seen things like what I'm experiencing, which is some vocal cord abnormalities. I will say that it is not routine, and it's not really the standard to get laryngoscopy on everyone after a tracheal shave, because again, the great majority of patients do just fine. And so perhaps finding a little bit of abnormality afterwards, I don't think it would change anything. Like I would still, like for myself, I still would have gone through it. So consult with your surgical team, ask the hard questions, and good luck with everything. So that concludes the session on tracheal shave. Cups up, my queers. Have a great day. Bye.